so that I can call, and I don't have my cheat sheet with me, and I'm sorry, I'm gonna do my best to see if I can remember. Now that I haven't seen you guys for like ever. Okay, Adiron? Yeah, yes. Nadia? Allison Ashmore. Okay. Clevion. I still messed it up, didn't I? Yeah. Okay. Amber. Tiffany. Tiffany Breyer. Well, she's not here while I'm going wrong. Nick. Britt. Deshauna? No Deshauna? Okay. Oh, this is probably an old sheet. Okay, Anna? Camacho? Okay. Amanda? Nicole? Kizzy? Lisa? Megan? Gil? She's in the closet. Veronica? Shunda? Caitlin? Mercy? Jamie?
Here.
Josepha? Lou? Tiffany? Miriam? Zafira? Patricia?
Here.
Jacqueline? Mary? Ashley? Jana? Arlene? Amy? Lanisha? Caitlin? Lestar?
Nope.
Jessica? And Darlissa. Hello. Okay. So we're just missing Deshauna and Lestar. 33, 34, 35. I thought I had 36 in this class. Allison Ashmore. Is she not here? Oh, okay. I thought you were like, oh, she's... Okay, now it makes 36. I was like, wait a minute, how did I mess up that addition? I can't add, can't speak. Okay, today we're going to talk about one of my favorite things, the root of all evil, the inflammatory process. And I'm going to spend the first part of the time talking specifically about the inflammatory process, because then after I get that up on the board and you guys have kind of gone through it, the exam part will probably there'll be some more understanding that you'll have with the exemplars, which are like otitis media, osteomyelitis, wrist or ankle sprain, trauma in the ankle, I guess is what it said. What else? I brought them.
Appendicitis,
pneumonia, cellulitis, vaccines, which is why I put this over here for you guys. I know you've probably already gone through this in class, but I want to at least refresh your memory because that's what I like to do best. Okay. I don't like it, just takes away my vision. One of these days I'll just have to get used to it, right? Quit whining about it. So I put a little reminder up here about the different types of white blood cells that are involved with immunity. Your basophils, eosinophils. The eosinophils, these are the guys that are most active when you're having allergies. Gotta love them. Lymphocytes, you've got T lymphocytes and B lymphocytes. And they do different things, but most of it just depends on where they mature. The T lymphocytes mature in the thymus, that's why they're called T lymphocytes. And those are your CD4 and CD8 cells. They're mostly responsible for cell-mediated immunity, which means they're the ones that are they're like the armed guards. They're patrolling around with their guns. The B lymphocytes, they basically hang out in the bone marrow, and they are specific. When we say the word humoral, don't think humorous. Humoral stands for, it's a Greek derivative from the word humors, which means bodily fluid. So humoral immunity just refers to the things that are floating around in your bodily fluids that do their job, which basically we know are your lymphocytes, monocytes, and neutrophils, most importantly. The other ones play part, but those are like your big guns. Monocytes, I always think of Pac-Man. They're the big fat ones that go through whenever something icky gets in, and they gobble it up, and they digest it, and then they die. That is the life of a monocyte. Then your neutrophils. When you're looking at a differential from a CBC count, the neutrophils are the ones that are supposed to be the most numerous. That's how I can always remember it. Neutrophils, numerous. So these are your most numerous white blood cells that are out swirling around, doing their job, looking for invaders. When we talk about different types of immunity, remember I told you humoral just has to do with all of these things. The things that are just floating around in your bodily fluids. Because that's literally what this word means, is bodily fluid. You have innate and you have adaptive. And being in the healthcare field, I always like to think of innate immunity as like your first responders. Like if there's a car wreck, those are the innate immunity, the first people there on the scene. They are their job, and innate is general immunity. This is the stuff that you just have all the time. Think of like Lady Gaga, Born This Way. Baby, I was born. Okay, that's what innate is. Innate is what you're born with. It's a general immunity, so it's not specific. It doesn't go along and like if I'm just going, looking around and like, okay, everything's supposed to be here. Wait, this is not supposed to be here. That's what innate immunity is. Immunity is like just generalized stuff. It's not specific. If I am adaptive, though, I'm specific. And I'm going to go through and I'm only going to look for pink glasses cases, because that is my, oh, look what I found! Okay. So, innate is the Lady Gaga, Born This Way. You've got it everywhere. The adaptive is specific. It's only going to look for very specific antigens. So innate, born with it. Adaptive, you acquire. This is antigen specific. So general, specific. Not the hair, hang on. These are real problems when you get a hair. And I wore my hair down today, which is my own fault. I shouldn't have done that, but I was feeling sassy this morning. That's when you just kind of get tired of pulling your hair back all the time. Okay. When we're talking about vaccines, your vaccines are going to fall into, or immunity in general, but the vaccine part is up here. So you have two different kinds of immunity. You have natural immunity and you have artificial immunity. Natural, as the name implies, is basically what happens naturally without a whole lot of artificial interference. So with natural active, the pathogen enters and your body goes through its normal response of taking names and keeping them on a list so they can kick their butt next time they show their ugly face. So this is something like when you get exposed, like chicken pox. So with active immunity, you get exposed to it and then you get antibodies formed. So AG is antigen, sorry, and AB is antibody. Natural passive, you can all thank your mama for this one. This is passed on naturally Natural are things that allow your body its own natural response. Artificial is we kind of force it to do something. So with artificial active, this is whenever we go get our vaccines. And after we get our vaccine, then we form antibodies. And that's a good thing. Those are things like things we get vaccinated for. MMR, flu. And then artificial passive, there's no real energy that gets used up with the passive immunity. So with this one, this mom gives us and we just kind of use it until it runs out. With artificial passive, we are given something that provides us a temporary force field shield. For example, restaurant workers every once in a while will have to go get a hepatitis A immune globulin shot if somebody wasn't washing their hands after they did something that they should have washed their hands after. And then there's a hepatitis A breakout. You guys all know how hepatitis A is passed along. So you can give immune globulin shots which give your body, after an exposure happens, but before you actually get it, you can get an immune globulin shot and it gives you passive immunity. Also, patients who have hypogammaglobulinemia, I know it's a word about this big, but basically it means their body doesn't produce enough immune globulins to arm the army that is normally protecting us 24/7. So they go in every 28 days and they get an infusion of immune globulin. And it's passive. Making sure I'm trying to keep. Immune globulin, this is temporary. This is probably long term. Just depending upon what we're talking about. So now let's do something that's kind of important. Some of these your body keeps track of and keeps a memory of it. Some of them your body doesn't. With your natural active, you do keep a memory of it. That's why if you get chickenpox when you're a little kid, you typically don't have to get a chickenpox vaccine until you're later in life. Because your body has remembered what that chickenpox virus looks like. It remembers those antigens, and when it gets exposed again, it goes, oh yeah, I know you, and it calls the particular B lymphocyte to go kill it. And they just have a memory of it. Don't ask me how, that's a whole immunological lecture. Passive, anything that's passive, typically your body doesn't have to expend any energy on it, so it's going to be no memory. So with artificial active, you know this is like your vaccine, a flu vaccine. Yes, your body does keep a memory of it, but does it last forever? No, we all know that. But we have a memory of it that lasts, we all know, about 6 to 8 months, which is enough to get us through the flu season. So artificial active does create a memory, but artificial passive, it's temporary, so there is no memory. Do you understand what I'm talking about?
Mm-hmm.
Yes, ma'am.
Natural passive, also no memory?
Natural passive, no memory. Because that's from mama, and those antibodies only get us through the first couple of months of life until our own immune system starts to go, hey, wait a minute, I don't think that's supposed to be here. Because for the first couple of months, their little bodies are just like, woo, whatever. And so we depend upon the mother's antibodies to get passed to us. Yes. Is there a hand over here? Okay. Do you keep raising your hand? I'm not ignoring you, or you just
No,
pulling your sleeves up?
sorry.
Well, you would kind of do this, and then you put back, and I'm like, okay, maybe I just answered your question. question, then you do like this, and I'm going to answer the question. I'm just gonna keep talking, maybe I'll just keep answering your questions. Okay. So that should refresh your memory on some things. So this is why your vaccines work. This is why some of them only work for a little while. And all of this depends upon the fact that your body needs to have the ability to create those memory cells of whatever it is, to create those antibodies. So if I don't have a functioning immune system, it doesn't matter, natural active, artificial active, whatever. You can shoot me full of vaccines all day. If I don't have a functioning immune system that can create effective antibodies, I have to depend upon that artificial passive a lot. And again, when you've got patients who have hypogammaglobulinemia, which I know is not one of your exemplars, but it's a word you're going to see out in the wicked world, and I want you to know what it means. It just means your body does not make enough immune globulins. And immune globulins are the proteins, and you guys have seen it before, IgG, IgA, IgM, IgE, IgD. Those are your immune globulins, and those are like your soldiers and your tanks and your army. And if your body doesn't make enough of those, then you don't have an appropriately functioning immune system. And these are the patients that have chronic sinus infections, chronic pneumonia, they have all these chronic illnesses because their body just doesn't have the strength and the tools to fight appropriately. So we can keep giving them artificial passive things, but I can tell you right now, immune globulin is very expensive. Like 3 to 5 grand. I haven't checked prices on immune globulin lately, but I remember when we were pouring it in the early 2000s, I say pouring it, I mean hanging it with patients. We had about almost 40 patients, and it's dosed in milligrams per kilogram. And the average dose for most people is 30 or 36 grams. And it was running about $150 to $250 a gram. So multiply that number times 30 or 36. So you're looking at about 5 grand plus minus every 28 days. Insurance companies don't like it. But when you look at, okay, do we pay 5 grand a month to have this medication given to this patient? Or do we keep letting them get hospitalized, which is thousands and thousands of dollars every time something happens? And it becomes, remember I told you in medicine, sometimes you got a crappy decision and a crappy decision. You have to pick which one's the least crappy and going to do the most good. So, good so far? Let's talk about the root of all evil. The inflammatory process. Oh, you guys just took a break. I was over with them. I just took a break. Okay. So your body is a temple. It goes along, everything's fine, until it's not. We have some sort of injury. Now don't get hung up on the word injury, meaning like I've cut my finger and that's an injury. An injury can be, oops, I just sprained my wrist. Or, that's my ankle, isn't it? I love anatomy. Okay. An injury can be, I have sprained my ankle. An injury can be, I just happen to be walking by somebody, let's say pre-mass, I happen to be walking by somebody who goes, "Achoo!" which, has happened. And you just feel every germ and their mucus hitting your skin. That could be an injury. Anything that breaks the force field is considered injury to your body. And I will tell you, even we can get that stuff in our eyes. That's why they tell you right now with all this stuff going on, don't touch your eyes, don't rub your nose, don't keep your fingers away from your mouth. Because in through your eyes, even though you have lysosomes in your tears, you can still have something on your hand. And I don't care if you wash your hands 50 times a day, there's still stuff. and you do like this, and you wipe your eyeball, guess what you just did? So, injury, don't get hung up on the word injury, meaning that there's blood and guts coming out. Injury is just any assault to my normal state of perfectness. Anytime you have an injury, immediately the body responds. The inflammatory process begins. Dun, dun, dun. So whenever something isn't right, your body immediately sends out little messengers called cytokines. That's why they're at the very top. And they're just like little tattletales. That's what they are. But that's good. You want little tattletales. But their job is just to go running around and find out where the problem is. But while they're running around, they're giving off signals that, hey, something's wrong, come with me, come with me. Hey, something's wrong, come with me, come with me. And that's what they're doing. They're running all through the body, giving off these signals, going, hey, there's something wrong, come follow me. And so that activates histamine, bradykinin, prostaglandins, platelets, white blood cells. Everybody that is involved with an immune response gets activated. Everybody has a job. So cytokines, these are the signalers. I don't even know if that's a word, but I just wrote it. Well, let's make that an R actually. Signalers. Their job is to make noise and get everybody stirred up. Histamine. Ooh-wee. Histamine's job is to start the process of breathing, start the process of the inflammation that is going to be happening. Where did my sweet paper go? There it is. So this is what my original notes look like, and then I took the time to rewrite them. Because I will wander off the reservation, and I'll just jump right into sepsis, and you guys are going to be going, what? Because this ties in beautifully with sepsis, but we'll talk about that later. So histamine. Histamine is responsible for inflammation, causing inflammation. It also makes you produce mucus. And you're going, well, what in the blah is that going to do? Think about it. Something's in the air, pollen, mountain cedar. So you breathe it in, and it gets into your nares, and your body goes, oh yeah, that's not supposed to be here. And so the cytokines start going, woo, something's wrong, come follow me. And histamine is one of the things that starts to follow it. Histamine makes your mucus start to be productive, because then what happens? You start with a runny nose, and it tickles, and what do? Achoo! We're trying to get it out. Anybody who has ever had an allergic reaction to something, you're very familiar with histamine. Bradykinin. Bradykinin also is responsible for inflammation. I'm just going to start abbreviating because I'm not even getting busy here. Inflammation, and it's also responsible for vasodilation and constriction. And I'll explain why that's really important here in just a second. Prostaglandins. Oh, these lovely little things. Prostaglandins are also part of the inflammation process, but these tend to make pain and fever. And inflammation. I'm just going to put inflammation here so you know that it's part of it. All of these essentially have to do with inflammation, but so palpitation, vasodilation, and constriction. Prostaglandins. They're the ones that are responsible for signaling the pain receptors and making you sense that there's pain. They also are responsible for cranking up the temperature. Because if I've cranked up the temperature, we're going to try to bake out whatever just got in. The pain is to make you stay off of it. Like if you just hurt your ankle, it's to make you limp. So that you're not putting all of your weight on it and injuring it further. Platelets, these little dudes get called in to stop bleeding. And then the white blood cells, you always know what they all do. But they're just down here. But why they're important to know down here is the white blood cells, the neutrophils, and the macrophages, you know, they're going to go eat up whatever it is, but they use energy. Step number 3. Don't worry, I'm giving you pieces, and then we'll talk about it as a whole, and this will make a lot more sense. So step number 3. Oops. That's- Looks like I hurt my finger. Goodness. I'm just malforming all of the letters of the alphabet. I apparently don't even pick favorites. I'll explain what I'm writing here in just a second. Because if I start talking while I'm writing, I start writing what I'm saying, and then it just gets all messed up. Okay, so I'm going to go back to the beginning. Our injury. And the body goes, oh, crap. So then it starts the process. The cytokines, they're the ones that go and they start ringing on the bells. Hey, 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 we have a problem. We have something here that's not supposed to be. Then the signal that it's sending off lets bradykinin, the histamine, prostaglandins, platelets, the white blood cells, everybody just gets released, and they're all looking to see where the problem is. The cytokines kind of go gather to wherever, once they find the area of invasion, they kind of gather there and they send out more signals, and that gives everybody the signal of where to be. See here where I wrote vasodilation and constriction? Histamine also does that. I should probably put that up there. causes this vasodilation? The vasodilation makes your capillary beds in that area leaky. And that's a good thing, because you guys all know your capillaries, the cells have like little gaps in them, right? And this is so it can allow things to go back and forth in your capillaries, like, oh, oxygen, waste products, stuff like that. So initially, when you have an injury, the bradykinin, the histamine, they cause those to leak. They make those gaps bigger. So the big fat monocytes, which are normally kept inside of my circulating vasculature, right? When those floodgates get opened up, now the monocytes, because they're big and they're fat, they can get out. Now they can get out here into this interstitial area wherever the injury is. And they can start cleaning up either whatever virus got in, whatever bacteria got in, or if there was damage to the area, they can start cleaning up, eating the dead skin. So first it dilates so that it allows those big fat white blood cells to get out and lets them go do their job. This leaking also is what causes the inflammation, because that's just extra fluid that's gotten out into the interstitial area. Then, pretty quickly, the body vasoconstricts, because we don't want stuff to just keep leaking out indefinitely. So we open up the gates long enough to get things out, and then we vasoconstrict. Because now we want, it's like we let the gates out to get all the army guys out, and then close the gates back up. Because we don't want anybody in our blood system. In a normal immune response, if I'm having a normal immune response, all of this stuff happens, and then we vasoconstricted, and the monocytes and the neutrophils and everybody goes out and they do their job, and then when they're all done and they get ready to die, their last dying breath, they give the all clear signal. And that tells the body to stop the cytokines so that these can all get stopped to be excessively produced. The immune response under normal conditions is self-limiting. The body goes through this process, injury, then the process begins. These guys get released first, which signals everybody else to come to wherever the problem is. The capillary beds open up, white blood cells go out, the capillary beds shut back down, and now we just kind of wait for the cytokines to quit sending out the signal. Once they stop sending out the signal, then our vasculature kind of rests and goes back to normal. The white blood cells, the neutrophils and the macrophages that went and did their job, they die, which is fine because we got a whole bunch more in the back. We're just waiting to bring them up. Histamine goes back down to normal. The bradykinins just kind of go back to circulating like they're supposed to. Prostaglandins go about doing their job. The platelets get back to normal. Everybody just goes back to normal in an effective, appropriate, self-mediated inflammatory response. How do you guys feel about this? Okay, let's talk about something. Well, I'll talk about something until 11:30 and I'll let you guys take a quick break. So you're going, this doesn't seem so bad. How can it be the root of all evil? If you have an injury, these guys all get released, they go do their job, the blood vessels open up so they can get out into that interstitial area, and everything closes back down, and we just wait for everything to get done, and the cytokines go, okay, all clear, and then we go back to normal. How is that the root of all evil? You want me to tell you? If it is not self-mediated, so we've gone to dilate, now we've gone to constriction, and we stay constricted. If my blood vessels are constricted in an area, what is not able to get through those blood vessels like normal? Oxygen. So I'm going to stay constricted. Long term, this is going to cause some cellular damage in this area because I'm constricted. I can't get oxygen out to those tissues. The phagocytosis, you know, where the neutrophils and the macrophages are doing their job, that phagocytosis is what keeps sending out the messages to the cytokines to keep releasing everybody. So my phagocytosis keeps happening, but I'm not mediating my response for some reason. So now they're just going to start eating stuff that isn't bad. Like this pink glasses. But they're going to start destroying things that we need, that are good things, because they aren't getting the message that they're supposed to stop. Because what they don't know is they're contributing to the problem because they're continuing to chomp, 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 which keeps the cytokines all stimulated. The other thing, remember down here when I wrote the white blood cells in particular, the neutrophils and the macrophages, they use a lot of energy. Just go with me. This has nothing to do with your exemplars on this semester. This is fourth semester stuff. But go with me. My white blood cells are out there doing their job. But they use a lot of energy. It takes a lot of energy to eat some icky thing up and then die. So you know your body makes ATP constantly, right? Because it has oxygen, and so it makes ATP and ATP. And we normally operate in aerobic respiration. You're familiar with the Krebs cycle? Remember all this? Like 36 ATP molecules with every cycle. It's a nice, efficient way to just keep producing energy. As these white blood cells keep sending out neutrophils and macrophages to go eat stuff, they're using up energy. And unfortunately, the body's just going to keep giving it whatever it needs. But remember, we're also vasoconstricted. If I'm vasoconstricted, it's very difficult to get oxygen out there, which is what they use for energy. So they're going to go, you know what? You keep telling us to go fight this war, guess what we're going to do? We're going to switch to anaerobic metabolism, which, as you know, anaerobic metabolism is very inefficient. Instead of a cycle giving me 36 ATP, I get like 2. And as you can imagine, just like a checking account, if my check every month is more than what I'm spending, then I have a surplus. But if my check every month does not overcome my incredible spending habits, I'm creating a deficit, and that can only go on for so long. Body's the same way. If I'm not giving them oxygen because my vessels are constricted, and these two dudes are still out there using up all my energy, my body's going to switch to anaerobic metabolism. A byproduct of anaerobic metabolism is lactic acid. Anybody ever worked out really hard or walked extra, and the next day you're like, ooh, these muscles are kind of sore. You know what's making your muscles sore, right? Lactic acid. You just got to kind of wait for the body to deal with it. Unfortunately, I'm not giving my body enough oxygen, and I keep using up energy, which uses up my oxygen. I've switched now to anaerobic metabolism, so I'm not creating enough energy, and I'm producing lactic acid. So as this cycle keeps happening and it's unchecked, I end up kind of getting some lactic acidosis going on. Anybody ever had to work with a patient who has a sepsis protocol going? One of the things that we do with an early warning for sepsis is we measure their lactic acid levels. Here's the why. Because this is happening, and this is happening, and with sepsis, it's an unregulated, this doesn't get stopped, it just keeps going. It's a bad circle. So as that circle continues to happen, and lactic acid keeps getting produced, and the body can only use it up so much at a time. But my body's got other things it's worrying about, so it's not really worrying about helping the body clear the out lactic acid that it's producing. So this is why when we have a sepsis patient, we measure their lactic acid, because that tells us how deep in this hole we are. They also are going to go into metabolic acidosis. And it's part of it has to do with all of the lactic acid that we're producing. And it's not a respiratory problem yet, it's a metabolic problem. Your problems are either going to be respiratory related or metabolic related. So if it's not a respiratory problem, it's going to be a metabolic problem. So I'm in lactic acidosis, which eventually is going to lead me into, very quickly, if not simultaneously, into metabolic acidosis. Now you guys remember we talked about acid-base balance. What is your body going to do to try to correct acidosis? You're going to start to hyperventilate to blow off CO2, because remember CO2 is respiratory acid. But it's one of the mechanisms that your body uses to help balance things back out, right? So now my patient is hyperventilating, my sick patient who has this going on, we're using up all their energy, we're using up all the oxygen, and they're panting. Their respiratory rate is going up. Well, you guys know the more my respiratory rate goes up, I'm going to keep blowing off carbon dioxide, and eventually I'm going to end up in respiratory alkalosis. And at this point, you are a sick little puppy. This is what happens to our septic patients. That's the why. Yes?
What causes it to keep going? What causes the macrophages to not just die and quit?
They do die, but your body still is getting the signal from the cytokines that something is wrong, so it keeps producing more. This is why when we do a CBC with a differential when our patients are sick, what we look at is what numbers, because you know you're supposed to have, your neutrophils are supposed to have bands and segs, and you're supposed to have more segmented monocytes than banded. The banded ones are the immature ones. The segmented ones are the mature, and this is whenever you do that differential and you see a lot of a lot of bands, that's when you know we are depleting resources, because now we're sending the babies out of the crib to go fight this war. It's just, the body, for whatever reason, is not mediating itself, and this can be multiple reasons. This can be that whatever the injury was, think about what this COVID thing that's going on. Some of these patients are going from like, I'm fine, to within an hour or so, I have a cough and I don't feel good, to dead in 6 hours. And a lot of it just has to do with this right here. How big, how bad was the injury? And then what reserves did I have to begin with? If I'm, and I can't even say anymore, if I'm young and healthy and have a good functioning immune system, that I'm okay, because we've had a lot of documented cases of young, perfectly healthy people with no underlying comorbidity. They run, they do all this stuff, they eat green, and they're dead in 6 hours. And here's one of those things, this is just purely my hypothesis, but I watch these numbers and I think about this, and what I feel is like we have this nicely, perfectly balanced system going on, and now all of a sudden this invader comes in and whacks it upside the head, and it just goes fire hoses. And I think that fire hose thing is this just going crazy. You know, if I have an underlying pathophysiology already, my body's already dealing with this to some degree. So I might not have the resources to have like a fire hose effect. So I might be able to hang in there a little bit longer. I'm going to get sicker than a dog, but I'll probably pull through on the other side. So some people, their body fire hoses the virus and they pull through. It's ugly, but they pull through. And some people, the body just gets overwhelmed. That's the only thing to me as a nurse and a scientist, and I say I'm a scientist in the sense that I'm always like reading things and trying to figure out. And that's the only thing that makes sense to me from somebody who teaches in the that's why some of these people that are perfectly healthy and like gone the next day, because it's just such an overwhelming response because their immune system is like on target. Look at me go, it's 11:33. Okay, take a 10-minute break and come back, and we'll put a few more of these pieces together and relate it to your exemplars. I want to see what my average heart rate was. Sure.
Oh, this mess. On the antibiotics, does she want us to write all of that stuff on there?
It's probably going to.
On the medicines, or just refer to it?
Lymphocytes, their lymphocytes are recognizing, okay, so this isn't necessarily dead.
And then she said individual work.
This is in the fact, but we have lymphocytes that have, HLA, which is human lymphocytic antigens on them. And that's how, it's like a little monitor. So our cells know, our fire cells know that, I'm not supposed to be attacked because I have them on. With some other agents, they don't want them on. So our cells.
She says summarize it. I mean, I'm not sure what her summary is.
It is just kind of a little spin. So with the HLA and the ANA, those are like monograms that we have. And those are, they just come with our cells. So that our body can go along and go, oh, you belong here, because we have the monograms. So like, if you walk into Blue Cross Blue Shield, you don't have a name badge, you don't have a name badge. If you get through the front door, and you see you have your name badge, you get attacked. But that's what it's like. It's like, this is a Pentagon. If you don't have your badge on, you don't belong here. And we are under the Pentagon, so all of our cells are supposed to have that information. So what if we have autoimmune diseases, some of their cells don't have that. That's grossly oversimplified way to put it. And it's like there's HLA, TNF-A, ANA, there's different acronyms for them. And again, this isn't like an immunology.
Could have sworn we did COPD before.
It's more, I think, related to rheumatoid arthritis, lupus and rheumatoid arthritis, things that have to do with, so like rheumatoid arthritis is the lining over the joint and the body attacks it, and with lupus is kind of the same thing. Your body is attacking the tissue that are supposed to be.
I don't understand how you give us all this shit right before that thing. She evil.